that work, right? Before we go in and cut the heart, push it which way?
Okay.
Here's the right auricle of the right atrium. There's the left auricle of the left atrium, a little harder to see, a little smaller looking. Ventricles are here, but it's a little hard to see right versus left until we cut it open. A lot of times with other animals, you'll see a really nice blood vessel running at an angle, and you should be able to get an impression of that from your rat. That's the anterior interventricular artery and vein, running on a groove called the anterior interventricular sulcus. That divides the right from the left atrium. I'm sorry, right from the left ventricles. Also, while we're here, let's look at the heart. I'm sorry, the lungs. We've got cranial, middle, posterior, and under here, there's a lot of blood on still, but the mediastinal lobe. And then for the left one, we only have one lobe. That's it. Highly asymmetrical. You notice how the heart comes to a point? That's called the apex. That's where we're going to make our cut. We're going to cut through the heart like so, so that the heart's going to open and close like a book, like the kidney did. In this case, the binding is going to be the great vessels of the heart. Now again, we're not cutting down like this. We're cutting like so. Now you got to be careful as you do this, because who knows what's going to happen when you cut into it. This is going to be a little different than cutting into the kidney, because there should be latex in the chambers. And if there's a lot of latex, it's going to be tough to cut through. It's going to be like cutting through a rubber ball. If there's not a lot of latex, you might have a lot of preservative in there that will squirt out at you when you cut it up. Or in some cases, like one of you I'm expecting, they never pumped all the blood out, so it'll look like the filling of a Milky Way bar when you cut it open. And you'll have to dig all that blood out. So again, starting at the apex, working our way carefully to the great vessels, so we can open and close this like a book, right, like there. So, they did not inject the right ventricle. It's open. Right there. It's like that dark line. Here's the left ventricle. They got the nice pink latex in there, right? You'll notice that the right ventricle's wall is thinner than the left. And there's our interventricular septum. And we can see the same thing on this side too, right? There's our left, our right, and you can try to pull this latex out, but frankly, I think that's more work than it's worth for these little guys. You may see a little white, which would be part of the valve system. I wouldn't worry about identifying that for the exam. It's just not worth your time, to tell you the truth. But that's it, that's all you have to do. Pretty simple. Now, if you want to cut windows in the trachea, for example, you could. To do that, I'd recommend you cut between a pair of rings, cut between another pair of rings, and then connect the cut on one side so it opens and closes like a window. And you can also do that with the esophagus, but frankly, with animals as tiny as these rats, you're not going to get anything out of that. What you will get out of cutting the trachea, if you choose to, is being able to see how the back of the trachea doesn't have the ring. Instead, it's going to have that muscle called the trachealis muscle. There's the esophagus behind the trachea. Right, any questions? Yes?
In that cut of the heart that you did, can you see any of the atria?
It's because the atria are so small in these animals that you have to be right at the right angle, but did a little bit right there, but you really can't see much of it, unfortunately.
And no coronary